B, fair. C, dysfunctional. D, the same as in other countries.
C. Dysfunctional.
The financing and payment system in this country is effective, fair, dysfunctional, or the same as in other countries?
Dysfunctional.
Dysfunctional is correct. Should I start? I can start with the first one. Did I? The mission of the public health system includes, the mission of the public health system includes 1, environmental health, 2, disease surveillance, 3, morbidity and mortality reports, 4, all of the above.
The above.
An important characteristic of the current healthcare system is the tension between the free market and government control. True or false?
True.
True is correct. Am I going too fast?
Yes.
Well, if I had a Pepsi like Monica here, I could take a sip in between.
We'll go get you one.
No, that's okay. That's okay. Major issues and concerns in healthcare include A, improving quality, B, racial disparities, C, improving access and coverage, D, slowing the growth of healthcare costs, E, all of the above.
Musca.
What did you say? What did you say?
Busca.
Well,
I
which
think
one is
it's all
it?
of the above.
All of the above. Sounds safe, huh? So I won't have to repeat it again. All right. Stakeholders are identified as A, consumers and taxpayers, B, service providers, C, payers, regulators, and accrediting bodies, D, pharmaceutical companies, E, all of the above.
All of the above.
All of the above is correct. Keeping people healthy is primarily the responsibility of the public health system. Is that true or false?
True. False.
Keeping people healthy is primarily the responsibility of the public health system. True or false?
True.
False.
Are you sure?
False.
He just took a stab at it, huh? Is it true or false?
True.
It is true. It is true. How do they do it? Immunizations,
Prevention.
disease surveillance.
They don't do a good job of
They do epidemiology when there's an outbreak of disease. You know, all of these things are for the whole population. And that's their job. Keeping people healthy is primarily the responsibility of the public health system. True or false? Is that the one I just asked you?
Yes.
Current healthcare expenditures in the U.S. stand at $2.3 trillion. True or false?
True.
Absolutely. $2.3 trillion.
True.
Relative to other countries, the United States spends at least, how much? Twice as much as other developed countries. 3 times as much. The same, none of the above. Relative to other countries, the U.S. spends at least, what? Twice as much, 3 times as much, the same, or none of the above?
3 times.
3 times as much?
Yes.
You all sure? You're wrong. Twice. Twice as much. But don't be discouraged. I want to hear your answers, even if you're wrong. All right. Reliable studies indicate that between...
Excuse you.
Reliable studies indicate, and I'm going to give you some figures, that between so much and so much, so many Americans die each year due to medical errors. Is that 23,000 to 48,000, 43,000 to 98,000, 68,000 to 100,000, or D, the number is not known? Which is it?
B.
C. The second one.
The second one.
B.
Are you sure?
Mm-hmm.
You're right, Rose. 43,000 to 98,000 die from medical errors. So be careful when you go to the hospital.
So 98.
Make sure whoever's
Thousand.
treating you knows what they're doing.
43 to 98.
Okay?
¿Qué number vamos?
I've heard some really horror stories. All right. Leading healthy lives is an important priority for most Americans. True or false?
False.
False?
Yes.
That's not a priority for most Americans?
No.
Sadly, but you're right. False. If it were true, we would have a different picture in healthcare in this country. Electronic communication will greatly enhance healthcare quality. True or false?
True.
Stakeholders. A, may have vested interest in healthcare delivery. B, may be beneficiaries of healthcare delivery. C, may be participants in a barbecue. D, all of the above.
Above.
I see a barbecuer right here. All right. I'm not picking on you.
Y'all got it wrong.
Sir, are you another question like that on the test?
What do you mean another question like
Because
that?
the last time people got it wrong because.
You thought I was kidding about the barbecuers. But you have to think, everybody, recipients as well as providers, as well as salespeople, as well as the drug companies, everybody who has anything to do with health is a stakeholder. In other words, you have an interest. Whether you're a receiver, or whether you're a provider, or whether you're a materials salesman, health care materials, drug companies. So, you know, something like this, barbecuers. Yeah, they're stakeholders in the healthcare system too.
Yeah, but if you're not thinking about
Ah, Alexis, you got, I want you to think, okay? So sometimes there'll be a couple of questions like that. It's not just to be tricky. Throw a little humor in. All right. The following are under direct federal government control except Veterans Health Care, Medicaid, TRICARE, Indian Health Service, and Medicare. I'm sorry. Veterans Health Care, Medicaid, TRICARE, Indian Health Service, and Medicare, which is not under federal government control.
TRICARE.
Which one?
Right here.
Well, TRICARE is the government service. Who's TRICARE for?
Military.
Sure.
The military. Yeah, that's definitely under government. Which other one? Under federal government.
Indian.
Indian Health Service, very much under federal.
Is it?
Yes,
Did you
it's
say
part of the U.S. Public Health
Name
Service.
them,
Did you
name
say
them,
Medicaid?
Medicaid state, right?
Veterans Health Care, Medicaid, TRICARE,
Oh.
Indian Health Service, Medicare.
Medicaid.
Medicare is under the state.
Medicaid or Medicare?
Medicaid.
Medicaid, yeah.
Medicaid is under the state. Of course, they get some federal funds, but it's administered by the state. All the others are federal. Indian Health Service is a federal health service, and it is a part of the U.S. Public Health Service. I know because I worked in the Public Health Service for a couple of years. Well, I know it because it's in the book, I should have said. All right. ACA stands for the new healthcare legislation. True or false?
True.
Well, that's a real giveaway. Well, I want to give you some extra.
Should put that in the test.
It's almost like extra credit. In the future, young people under 28 will have health insurance coverage through their parents if living at home. True or false? False. 26 is the limit, okay? The earliest health care in the U.S. was provided in almshouses.
Yes.
And featured only A, medicines, B, food and shelter, C, counseling, D, preventive services, E, all of the above.
Food and shelter.
Food and shelter.
Food and shelter is which one?
BD.
B. You're right. That's how it began. We'd be in better shape if that's all that we're given today. Well, maybe not. Medical education came of age during A, the American Revolution, B, the Age of Reason, C, the early 20th century, D, the 1960 healthcare reform, none of the above. Medical education came of age during the American Revolution, the Age of Reason, the early 20th century, the 1960 healthcare reform, none of the above.
None of the above.
You want to take a stab at it?
1960 healthcare.
The American Revolution?
No.
Early 20th.
Before.
Healthcare reform? No, but Medicaid.
No, we had medical education before then.
Is it 20?
The early 20th century. You know, the 1910, 1920, early 20th century. So that would be C. Okay. Hill Burton, A, was a dedicated physician who took care of the poor. Why are you smiling, Rosie?
Because I'm thinking.
B, was legislation providing funds for building hospitals?
That one.
Yes.
C, started the first insurance company in Pennsylvania? None of the above.
He built the hospital.
Bill Burton, right, was legislation passed to provide funds for building hospitals? I think that legislation is still in the books.
Pretty good.
Medicare was legislated under the presidency of Dwight Eisenhower, Richard Nixon, Lyndon Baines Johnson, Jimmy Carter, or Jerry Ford?
Johnson.
Who said Johnson?
No.
You're right. Right, it was under President Johnson. Medicaid is supported by the federal government, the states, a combination of the feds and the states, private foundations,
Combination of states. Combination.
a combination of the federal government and the states. That's C. The U.S. government spends more money on education than on Medicaid. Is that true or false? Sure is. Nobody spends more money than Medicaid. Well, Medicaid and Medicare combined. Medicaid is a social insurance program and Medicare is a social welfare program. Is that true or false?
False.
Oh, is it the other way around?
Yes.
Okay.
What was it?
Oh, you weren't listening. Let me give it to you again. Medicaid is a social insurance program and Medicare is a social welfare program.
False.
Sure is, because Medicare is not a social welfare program. In other words, if it was a social welfare program, everybody would be eligible for it. I mean, it would be for all the poor and all this kind of stuff. Instead, it's primarily for the elderly. The number of uninsured persons in the USA is approximately A, 78 million, B, 50 million, C, 45 million, D, unknown.
50 million.
You want to put your money on 50? It's a good bet. A federal oversight law. Do you need a little break for your fingers to get some blood flow?
No, let's keep going, because then we're gonna be 8.
All right. A federal oversight law that limits the state's authority to regulate the health insurance industry is known as A, HIPAA, B, PPACA, C, ERISA, D, none of the above. Anybody what do you, is in accord?
Concur.
Concur. Thank you for the word. Anybody concur? No? Well, it's right. We only got
ERISA.
one person who knew it. ERISA, that would be C. A federal oversight law that limits the state's authority to regulate the health insurance industry is ERISA. The new healthcare legislation that forces all citizens to buy health insurance is known as PPACA. All right. Mental health hospitals are under the supervision of A, the federal government, B, the states, C, the counties, D, the city government. The states is correct. A leader in the mental health care movement was named, Ann Taylor, Betsy Ross, Dorothy Dixon, Hillary Clinton, Oprah Winfrey.
Miss Dixon.
Ms. Dixon.
It was Miss Dixon.
Dorothy Dix. Dorothea Dix. It wasn't Dixon.
Well, that's how we remembered it.
D-I-X.
That was her.
Okay.
That one you remembered very well.
44,000 to 98,000 Americans die each year due to A, tobacco, B, alcohol-related illnesses and accidents, C, heart disease, D, cancer, E, medical errors.
Medical errors.
That was
I don't know why I gave that. It's given to you in two different ways. Same question.
Same question.
I just put it backwards. 44,000 to 98,000 Americans die each year due to medical errors. Public health clinics are the institutions of last resort for the poor. True or false?
True.
Goals and objectives for the new healthcare bill include all except tort reform, more money for research, more money for prevention and wellness, more money for school nutrition, better reimbursement and cost containment. Which one is not an objective?
School nutrition?
Anybody on this side? D. It does not have